Phlebotomy test prep full review. Question 1. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A, 2 to 4 hours. Option B, 4 to 6 hours. Option C, 8 to 12 hours. Option D, 18 to 24 hours. The correct answer is option C, 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 2. What is the minimum amount of time a serum separator tube, SSD, must stand in a vertical rack to clot completely before centrifugation? Option A, 5 minutes. Option B, 10 minutes. Option C, 30 minutes. Option D, 90 minutes. The correct answer is option C, 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 3. What type of specimen is used for a guaiac smear test? Option A, sputum. Option B, urine. Option C, feces. Option D, cerebrospinal fluid. The correct answer is option C, feces. A guaiac smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 4. Which of the following tests is used to monitor a patient's heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, hemoglobin A1c. Option D, rheumatoid factor, RF. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 5. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A, facing downward. Option B, facing upward. Option C, facing to the left. Option D, facing to the right. The correct answer is option B, facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 6. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A, rapid hematoma formation and bright red pulsing blood. Option B, falsely decreased systemic blood pressure. Option C, accelerated hemolysis within the vacuum collection tube. Option D, immediate collapse of the surrounding capillary beds. The correct answer is option A, rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 7. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option A, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 8. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C. The vacuum tubes will implode due to tissue density variations. Option D. It will cause immediate and permanent paralysis of the limb. The correct answer is option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 9. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A. It causes severe tissue tearing upon skin entry. Option B. It carries an extremely high risk of causing hemolysis in the sample. Option C. It penetrates too deeply into the bacillic structures. Option D. Vacuum tubes will lose their suction pressure entirely. The correct answer is option B. It carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 10. What is the standard gauge size of a needle used for routine adult venipuncture in most clinical settings? Option A. 18 gauge. Option B. 21 gauge. Option C. 25 gauge. Option D. 16 gauge. The correct answer is option B. 21 gauge. A 21 gauge needle is commonly used for routine adult venipuncture because it balances adequate flow with acceptable patient comfort. It is large enough to reduce hemolysis risk in normal veins. Smaller gauges may be used for fragile or small veins, but they are not the routine default. Question 11. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A. Flammability hazard. Option B. Reactivity hazard. Option C. Health hazard. Option D. Special or specific hazard. The correct answer is option C. Health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 12. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A. Activated partial thromboplastin time, APTT. Option B. Bleeding time test. Option C. Prothrombin time / international normalized ratio, patient / INR. Option D. Complete blood count, CBC. The correct answer is option C. Prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 13. What does the term Basal state refer to in clinical laboratory testing? Option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B. The physical state of the body directly following a heavy workout session. Option C. The point of highest metabolic activity in the afternoon. Option D. The body state while under heavy psychological stress. The correct answer is option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 14. What should a phlebotomist do if they accidentally puncture an artery during an attempted venipuncture? Option A. Complete the draw quickly and label the tube as venous blood. Option B. Remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. Option C. Leave the tourniquet tied tight to prevent a hematoma from forming. Option D. Instruct the patient to bend their arm firmly over a gauze pad. The correct answer is option B. Remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. An arterial puncture during venipuncture requires immediate needle removal and firm direct pressure for an extended period. Nursing staff or the provider should be notified because arterial bleeding can form a significant hematoma. Continuing the draw or applying light pressure is unsafe. Question 15. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A. Check the site to confirm that active bleeding has completely stopped. Option B. Ask the patient to bend their elbow firmly over the gauze pad. Option C. Apply a generous layer of antibiotic ointment to the wound. Option D. Label the tubes using the patient's bedside charts. The correct answer is option A. Check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 16. Which of the following tests is part of a routine liver function panel? Option A. Creatinine. Option B. Alanine aminotransferase, ALT. Option C. Hemoglobin A1c. Option D. Troponin I. The correct answer is option B. Alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 17. Which of the following is an example of an analytical component of quality assurance? Option A. Double-checking patient identity wristbands. Option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Option C. Delivering critical panic results to a physician on time. Option D. Labeling the collection tubes at the bedside. The correct answer is option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 18. What is the proper location for a capillary puncture on an infant's foot? Option A. The center of the plantar surface near the arch. Option B. The medial or lateral borders of the plantar surface of the heel. Option C. The tip of the great toe. Option D. The posterior curvature of the heel bone. The correct answer is option B. The medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 19. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic metabolic panel, BMP. Option B. Forensic drug analysis or paternity testing. Option C. Therapeutic drug monitoring for digoxin. Option D. Blood culture tracking for endocarditis. The correct answer is option B. Forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 20. What color top tube is used to collect specimens for lead testing? Option A. Tan or royal blue with EDTA. Option B. Light blue. Option C. Light green. Option D. Yellow. The correct answer is option A. Tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 21. What does the term homeostasis mean? Option A, the stoppage of blood flow from an injured vessel. Option B, the steady state or dynamic balance of the body's internal environment. Option C, the destruction of old red blood cells in the spleen. Option D, the production of new cellular elements in the bone marrow. The correct answer is option B, the steady state or dynamic balance of the body's internal environment. Homeostasis is the body's dynamic process of maintaining internal stability. It includes regulation of temperature, fluids, pH, glucose, and other physiologic variables. Hemostasis is specifically the stopping of bleeding and is a different term. Question 22. Which of the following situations requires a phlebotomist to follow airborne precaution protocols? Option A, collecting blood from a patient with a suspected MRSA skin infection. Option B, drawing samples from a patient diagnosed with measles or active varicella. Option C, performing venipuncture on a patient with seasonal rhinovirus. Option D, collecting a lipid panel from a patient with hepatitis C. The correct answer is option B, drawing samples from a patient diagnosed with measles or active varicella. Measles and active varicella spread by airborne particles and require airborne precautions. This includes an appropriate respirator and a negative pressure room when available. MRSA skin infections usually require contact precautions, and hepatitis C follows blood-borne standard precautions. Question 23. When centrifuging specimens, what is the most important operational rule to follow? Option A, centrifuging serum tubes immediately before they clot. Option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C, leaving the lid open slightly to prevent overheating of the tubes. Option D, setting the speed to the maximum RPM regardless of tube type. The correct answer is option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 24. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B, tighten the tourniquet further to stop the spots from spreading. Option C, ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D, rub the skin surface firmly to see if the spots disappear. The correct answer is option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 25. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 26. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A, proceed immediately to get the draw over with quickly. Option B, instruct the patient to take slow, deep breaths and offer reassurance. Option C, reschedule the test for a different week. Option D, administer a sedative if available in the room. The correct answer is option B, instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 27. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 28. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 29. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 30. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option D, lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 31. What does the term phlebotomy literally mean in Greek? Option A, to clear a blood clot. Option B, to measure blood cells. Option C, to cut into a vein. Option D, to study circulating fluids. The correct answer is option C, to cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 32. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A, cyanosis. Option B, jaundice, icterus. Option C, erythema. Option D, pallor. The correct answer is option B, jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 33. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A, interpreting abnormal lab results for patients. Option B, ensuring specimen tubes are collected, labeled, and transported correctly. Option C, changing medication doses based on therapeutic levels. Option D, performing complex tissue biopsies in the operating room. The correct answer is option B, ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 34. What should a phlebotomist do if they encounter an unconscious patient in an emergency room with no identification band? Option A. Refuse to draw the blood until the patient wakes up and identifies themselves. Option B. Assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. Option C. Use the name written on the patient's personal clothing or belongings. Option D. Label the tubes with John Doe and leave the medical record number blank. The correct answer is option B. Assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. An unidentified emergency patient may receive a temporary unique identifier under facility protocol. Specimens are labeled with that identifier so testing can proceed while maintaining traceability. Clothing, belongings, or generic names are unsafe sources of identity. Question 35. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A. Powdered latex. Option B. Non-powdered latex. Option C. Nitrile or vinyl. Option D. Cotton utility gloves. The correct answer is option C. Nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 36. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act, HIPAA? Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 37. Which of the following elements is a primary link in the chain of infection? Option A. The source or reservoir of the pathogen. Option B. The cost of personal protective equipment. Option C. The layout of the outpatient laboratory facility. Option D. The brand of antiseptic wipes used to clean benches. The correct answer is option A. The source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 38. How should a phlebotomist approach a child who needs a blood test? Option A. Tell them it will not hurt at all to gain their trust. Option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C. Have 3 guards hold them down before introducing yourself. Option D. Show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 39. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A. The needle will slip and miss the vein entirely. Option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C. The patient's blood pressure will drop rapidly. Option D. The vacuum inside the collection tube will increase significantly. The correct answer is option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 40. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 41. Which of the following is considered an acceptable site for venipuncture if antecubital veins are unavailable? Option A, the dorsal aspect of the wrist. Option B, the dorsal aspect of the hand. Option C, the anterior aspect of the foot. Option D, the saphenous vein in the ankle. The correct answer is option B, the dorsal aspect of the hand. Dorsal hand veins are an acceptable alternate site when antecubital veins are unavailable. They are more superficial but may require a smaller needle and careful anchoring. Wrist, foot, and ankle sites carry greater risk and often require special approval. Question 42. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A, routine cholesterol screen. Option B, workplace drug testing. Option C, blood culture for endocarditis. Option D, complete blood count for anemia. The correct answer is option B, workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 43. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during the draw? Option A, use the partial sample anyway and send it to the lab. Option B, discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C, pour blood from a green top tube into the light blue tube to top it off. Option D, shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 44. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A, plasma. Option B, serum. Option C, whole blood. Option D, fibrinogen-rich extract. The correct answer is option B, serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 45. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent. The correct answer is option A, informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 46. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B, A patient with an open, draining MRSA wound infection. Option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D. A patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 47. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A. An N95 respirator mask and shoe covers. Option B. A standard surgical mask and gloves. Option C. A full-body Tyvek suit and goggles. Option D. No personal protective equipment is required. The correct answer is option B. A standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 48. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 49. Which of the following tubes contains the anticoagulant lithium heparin? Option A. Light green top, PSD. Option B. Dark blue top. Option C. Yellow top. Option D. Gray top. The correct answer is option A. Light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 50. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A. Dropping a needle into the sharps box immediately after withdrawal. Option B. Pushing down on items inside a full sharps container to make extra room. Option C. Disposing of a sharps box when it reaches the indicated full fill line. Option D. Placing the sharps container at eye level near the point of use. The correct answer is option B. Pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 51. If a phlebotomist must use a syringe to collect blood, what device should be used to transfer the blood into vacuum tubes? Option A. A standard needle attached to the syringe puncturing the tube top directly. Option B. A syringe transfer device with a shrouded needle. Option C. Pouring the blood from the syringe barrel after removing the stopper. Option D. Injecting it through a butterfly needle set. The correct answer is option B. A syringe transfer device with a shrouded needle. A syringe transfer device allows blood to move safely from a syringe into vacuum tubes without exposing the needle. The device reduces needle stick risk and helps maintain tube vacuum and fill order. Removing stoppers, pouring blood, or puncturing stoppers with an exposed needle is unsafe. Question 52. What tube additive prevents clotting by binding or chelating calcium? Option A. Lithium heparin. Option B. DDTA. Option C. Sodium polyethylsulfonate. Option D. Thrombin. The correct answer is option B. EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 53. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 54. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 55. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A, using a needle with a large lumen, such as an 18-gauge needle. Option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C, inverting a serum separator tube gently 5 times after collection. Option D, centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 56. Which of the following is an example of a vector-borne transmission? Option A, contracting a cold from an airborne sneeze. Option B, acquiring a skin infection from a contaminated countertop. Option C, getting bit by a mosquito infected with West Nile virus. Option D, drinking water containing bacterial toxins. The correct answer is option C, getting bit by a mosquito infected with West Nile virus. Vector-borne transmission involves a living carrier that moves an infectious agent from one host to another. Mosquito transmission of West Nile virus is a classic example. Airborne droplets, contaminated surfaces, and contaminated water represent other transmission routes. Question 57. When using a butterfly wind infusion set with a light blue top tube, why must a discard tube be drawn first? Option A, to clear any residual skin surface contaminants from the needle. Option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Option C, to activate the coagulation cascade prior to sample collection. Option D, to check if the vein has adequate pressure to fill a full tube. The correct answer is option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 58. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A, prone position. Option B, high Fowler's position. Option C, supine with legs elevated or flat. Option D, standing upright with assistance. The correct answer is option C, supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 59. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 60. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 61. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A, the blood is typically dark red or maroon. Option B, the blood will pulse spontaneously into the syringe. Option C, a tourniquet must be applied extremely tight. Option D, the angle of needle insertion is 15 degrees. The correct answer is option B, the blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 62. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A, polycythemia. Option B, anemia. Option C, leukemia. Option D, leukopenia. The correct answer is option B, anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukopenia involves white cells. Question 63. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A, change the requisition manually using a pen to match the verbal statement. Option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C, draw the blood and sort out the labeling discrepancy later in the lab. Option D, assume the patient knows their own name and print a new label on the spot. The correct answer is option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 64. What is the primary purpose of the laboratory's safety data sheets, SDS? Option A, to track the daily attendance and performance records of employees. Option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Option C, to schedule the preventative maintenance routines for centrifuge machines. Option D, to log the critical panic values reported to physicians. The correct answer is option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 65. What is the primary purpose of the multisample needles rubber sleeve? Option A. To cushion the patient's vein from sudden movements. Option B. To prevent blood from leaking into the tube holder adapter between tube changes. Option C. To keep the needle sharp until it enters the vein. Option D. To guide the needle into the exact center of the vacuum tube. The correct answer is option B. To prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 66. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A. Over-isotonic chilling. Option B. Exposure to direct room light or sunlight. Option C. Inverting the tube more than 10 times. Option D. Delays in serum separation beyond 4 hours. The correct answer is option B. Exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 67. For which of the following tests must a phlebotomist use a grey top tube containing potassium oxalate? Option A. Erythrocyte sedimentation rate, ESR. Option B. Oral glucose tolerance test, OGTT. Option C. Activated partial thromboplastin time, APTT. Option D. Blood urea nitrogen, BUN. The correct answer is option B. Oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses grey tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 68. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A. A 24-hour pooled collection. Option B. A random, first morning voided specimen. Option C. A multisample postprandial catch. Option D. A catheterized 12-hour collection sequence. The correct answer is option B. A random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 69. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A. Sodium polyant whole sulfonate, SPS. Option B. Acid citrate dextrose, ACD. Option C. Sodium citrate. Option D. Potassium oxalate. The correct answer is option B. Acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 70. What should a phlebotomist use to clean a workspace surface that has been contaminated by a blood spill? Option A. 70% isopropyl alcohol. Option B. A 1:10 dilution of sodium hypochlorite, bleach. Option C. Plain warm soap and water. Option D. Concentrated chlorhexidine solution. The correct answer is option B. A 1:10 dilution of sodium hypochlorite, bleach. Blood spills should be disinfected with an appropriate bleach dilution or approved hospital disinfectant. A 1:10 sodium hypochlorite solution is commonly used because it inactivates many blood-borne pathogens. Soap and water alone remove soil but do not provide adequate disinfection for a blood spill. Question 71. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A, transporting the specimen to the laboratory on ice. Option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C, using a green top tube containing sodium heparin. Option D, labeling the specimen tube at the patient's bedside. The correct answer is option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 72. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 73. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 74. Which of the following conditions can lead to a lipemic specimen? Option A, the patient did not fast before a lipid panel draw. Option B, the specimen was hemolyzed during collection. Option C, the tube was left under direct light for too long. Option D, the patient was severely dehydrated. The correct answer is option A, the patient did not fast before a lipid panel draw. Lipemia often occurs when blood is drawn after recent dietary fat intake, especially before lipid testing. The serum or plasma may look cloudy or milky from circulating lipoproteins. Hemolysis causes a red tint, while icterus produces a yellow to amber color. Question 75. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A, allowing a serum separator tube to clot completely before centrifugation. Option B, balancing the centrifuge correctly with tubes of equal volume. Option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D, keeping a plasma specimen chilled on an ice slurry. The correct answer is option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 76. Which of the following represents an occupational exposure route for a blood-borne pathogen? Option A, blood splashing into a phlebotomist's eyes. Option B, touching an intact skin surface with clean hands. Option C, inhaling air in a well-ventilated laboratory room. Option D, spilling saline solution onto a lab bench. The correct answer is option A, blood splashing into a phlebotomist's eyes. Blood splashing into the eyes is an occupational exposure because mucous membranes can transmit blood-borne pathogens. Eye protection is used when splash risk exists to prevent this route of exposure. Contact with intact skin or clean surfaces does not carry the same exposure risk. Question 77. Which of the following actions represents the correct method for mixing an additive collection tube after drawing? Option A, shaking the tube vigorously up and down 10 times. Option B, inverting the tube gently back and forth the recommended number of times. typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Option C, letting the tube sit completely undisturbed in a vertical rack to mix over time. Option D, rolling the tube vigorously between your palms for 2 minutes. The correct answer is option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Additive tubes must be mixed by gentle inversion for the number of times recommended for that tube type. This distributes the additive evenly without causing hemolysis. Vigorous shaking or inadequate mixing can create clots, cell damage, or inaccurate results. Question 78. Which gauge needle has the smallest lumen diameter? Option A, 18 gauge. Option B, 21 gauge. Option C, 23 gauge. Option D, 25 gauge. The correct answer is option D, 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 79. Which of the following options defines the proper site for performing a venipuncture on a patient's hand? Option A, the ventral aspect of the wrist near the radial artery. Option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Option C, the inside aspect of the thumb pathway. Option D, the lateral borders of the palm. The correct answer is option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Hand venipuncture is performed on the dorsal venous network on the back of the hand. These veins are superficial and require careful anchoring and a shallow angle. The palm, wrist, or underside of the hand carries more risk and is not preferred. Question 80. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B, it can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 81. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 82. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, radial vein. The correct answer is option B, basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 83. What should a phlebotomist do if they accidentally touch the site after it has been cleansed with alcohol? Option A, proceed with the venipuncture immediately before the site gets contaminated further. Option B, blow on the skin surface to dry any skin oils that transferred. Option C, re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Option D, wipe the needle tip with alcohol before inserting it into the skin. The correct answer is option C. Re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Touching a cleaned puncture site recontaminates the skin and compromises antisepsis. The site should be cleansed again with a fresh prep pad and allowed to air dry. Wiping the needle or blowing on the skin does not restore a clean field. Question 84. Which of the following statements is true regarding a multisample needle gauge? Option A 21 gauge needle has a larger opening than a 22 gauge needle. Option B, an 18 gauge needle is smaller than a 23 gauge needle. Option C, the larger the gauge number, the larger the needle lumen. Option D, all needles used in phlebotomy have the same internal diameter. The correct answer is option A 21 gauge needle has a larger opening than a 22 gauge needle. Needle gauge numbers work inversely, the higher the number, the smaller the lumen. A 21 gauge needle therefore has a larger opening than a 22 gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 85. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A, health hazard. Option B, flammability hazard. Option C, instability or reactivity hazard. Option D, specific or special hazard. The correct answer is option C, instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 86. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A, layered drop upon drop until the circle is saturated. Option B, applied to both sides of the paper simultaneously. Option C, brought into direct contact with a single large drop to fill the circle completely. Option D, smeared across the surface using a plastic capillary tube. The correct answer is option C, brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 87. Which of the following tests requires that the sample be protected from light by wrapping the tube in aluminum foil? Option A, vitamin B12 and carrot. Option B, blood urea nitrogen, BUN. Option C, partial thromboplastin time, PTT. Option D, complete blood count, CBC. The correct answer is option A, vitamin B12 and carrot. Vitamin B12 and carrot are light sensitive and may require protection with foil or an amber container. Light exposure can degrade sensitive analytes and produce inaccurate results. BUN, PTT, and CBC do not have the same routine light protection requirement. Question 88. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A, drawing blood from a patient who has explicitly refused the procedure. Option B, making a minor clerical error on a specimen tube label. Option C, forgetting to wash hands between routine patient encounters. Option D, accidentally causing a small hematoma during an authorized draw. The correct answer is option A, drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 89. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 90. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT, instruments. Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 91. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A, petechiae. Option B, hematoma. Option C, thrombus. Option D, hemostasis. The correct answer is option B, hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 92. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A, draw the blood from a capillary puncture if the tests allow. Option B, turn off the for yourself and draw above the line immediately. Option C, draw from the foot or ankle without a physician's order. Option D, postpone the draw indefinitely until the patient is discharged. The correct answer is option A, draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 93. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 94. What clinical term describes the liquid portion of a blood specimen that has been allowed to clot completely before centrifugation? Option A, plasma. Option B, serum. Option C, whole blood. Option D, buffy coat. The correct answer is option B, serum. Serum is the liquid portion of blood after the sample has clotted completely and been centrifuged. It lacks fibrinogen because fibrin clot formation has already occurred. Plasma is obtained from anticoagulated blood. Question 95. What is the function of sodium polyethylene sulfonate, SPS, inside a yellow top blood culture tube? Option A, to inhibit the growth of bacteria. Option B, to preserve glucose levels for bacterial metabolism. Option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. Option D, to lyse red blood cells to release intracellular pathogens. The correct answer is option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 96. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A. The veins are too large and prone to exploding. Option B. The lack of muscle movement leads to poor circulation and potential thrombosis. Option C. The patient cannot feel if a nerve is being struck by the needle. Option D. Paralyzed limbs do not contain white blood cells. The correct answer is option B. The lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 97. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option of light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 98. Which of the following can lead to a rejected specimen due to short draw? Option A, inverting a lavender tube 8 times. Option B, underfilling a light blue coagulation tube. Option C, using a 21 gauge needle on a large vein. Option D, drawing a serum separator tube before a green tube. The correct answer is option B, underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 99. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 100. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A, 70% ethyl alcohol. Option B, povidone. Option C, hydrogen peroxide. Option D, benzalkonium chloride. The correct answer is option B, povidone. Povidone is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose.